Nutrition science, lipids, and disease. Heart disease is the leading cause of death of the United States, and deaths from stroke, which shares many of the same risk factors, accounts for additional fatalities each year. The burden of cardiovascular disease makes it critical to address dietary and lifestyle choices that can decrease risk factors for these diseases. According to the American Heart Association, the following risk factors for heart disease are modifiable, meaning they can be managed or changed by the individual. High blood pressure, high blood cholesterol, tobacco use, diabetes, poor diet, physical inactivity, and overweight or obesity. In light of these risk factors, there are many dietary strategies related to fat intake that can reduce the risk of heart disease. The amount and type of fat that a person eats can have a profound effect on the way their body metabolizes fat and cholesterol. If left unchecked, improper dietary fat consumption can lead down a path to severe health problems. An elevated level of lipids, including triglycerides and cholesterol, in the blood is called hyperlipidemia. Many diseases and health conditions are associated with high blood lipid levels, including cardiovascular disease, heart attack, stroke, congestive heart failure, and obesity. Recommended fat intake. Because of the association between dietary fat consumption and hyperlipidemia, health experts have developed recommendations for fat intake to help guide food choices. The acceptable macronutrient distribution range, or AMDR, from the Dietary Reference Intake Committee, and recommendations for adult fat consumption from the Dietary Guidelines for Americans are as follows. Fat calories should be limited to 20 to 35% of total calories, with most fats coming from polyunsaturated and monounsaturated fats, such as those found in fish, nuts, and vegetable oils. Consume fewer than 10% of calories from saturated fats. Some studies suggest that lowering the saturated fat content to less than 7% can further reduce the risk of heart disease, but other studies contraindicate this recommendation. Keep the consumption of trans fats or any food label that reads partially hydrogenated oil as low as possible, as manufactured trans fats are being phased out of the U.S. food supply. Americans don't have to worry as much about identifying and avoiding trans fats. However, they're still used in other parts of the world. Choose more lean and low-fat products when selecting meat, poultry, milk, and dairy products. The complicated relationship of saturated fat with heart health. Being conscious of the need to reduce blood cholesterol levels to improve health often means limiting the consumption of saturated fats. Multiple studies have shown an association between the saturated fats found in some meat, whole fat dairy products, butter, and tropical oils, such as coconut and palm oils, and higher LDL cholesterol levels. However, while saturated fats have a historical reputation for being unhealthy, more recent research has suggested that the link between saturated fat and heart disease may not be as clear-cut as we once thought. The BMJ's analysis on dietary fat and heart health explains the complicated relationship as such. Synergism and interactions between different components of foods, together with the degree of processing and preparation or cooking methods, lead to a food matrix effect, which is not captured by considering single nutrients. Different types of food that are high in saturated fats are likely to have different effects on health. For example, dairy products and processed meats, both high in saturated fat, are differentially associated with many health outcomes in prospective epidemiological studies, often in opposite directions. One explanation for this divergence is that despite their similar fat content, other components of these two food groups are associated with different health effects. For example, dairy products contain minerals such as calcium and magnesium and have probiotic features if fermented, whereas processed red meat has a high salt and preservative content. To produce public health guidelines on which foods to eat or avoid to reduce the risk of chronic diseases is complicated because dietary fats are typically mixtures of different types of fatty acids. Animal fats, for instance, are the main source of saturated fats in many modern diets, but some animal fats are higher in monounsaturated fats than saturated fats, and polyunsaturated fats in vegetable oils will typically contain both omega-3 and omega-6 fatty acids in different concentrations. Hence, conclusions about the health effects of saturated and polyunsaturated fatty acids are unlikely to consistently translate to the health effects of the fats, oils, and foods in which those fatty acids are present. There is insufficient evidence from prospective epidemiological studies to conclude that dietary saturated fat is associated with an increased risk of cardiovascular disease. Researchers state that reducing saturated fat intake may not clearly decrease CVD risk, in part because people tend to replace saturated fat with processed carbohydrates. Studies have attempted to tease out different approaches to lowering saturated fat in the diet, showing that the types of foods used to replace saturated fat affect the risk of heart disease. If saturated fat in the diet is replaced with unsaturated fat, risk for heart disease decreases. If saturated fat in the diet is replaced with refined carbohydrates, the risk for heart disease increases. In 2015, the DGA report described the evidence as follows. Strong and consistent evidence shows that replacing saturated fats with unsaturated fats, especially polyunsaturated fats, is associated with reduced blood levels of total cholesterol and of low-density lipoprotein cholesterol, or LDL cholesterol.